So thank you all for coming today. We appreciate your time as we know how busy everyone is at the moment. Please note that we are recording the webinar and a copy will be shared alongside the slides on our hub pages. Due to the numbers on the call, cameras and microphones have been disabled and we have scheduled this session for 1 hour. We will be sharing some polls, undertaking short survey questions and evaluations. For some of these there will be a link and/or a QR code, and others will be embedded into the chat function on Teams. Have your cameras ready if you want to use the QR codes. Remember, you can also use the chat function to make comments and ask questions. We will have colleagues monitoring the chat and will check at the end of the session that these have been covered. If we run out of time, we will pick up any unresolved questions after the webinar. And if you would like any further support after the webinar, please use the Safe Staffing email and we will respond to your request. To start, we want to overview of the Safe Staffing team. We wanted to introduce ourselves, and my name is Steph Tom and I am the programme lead, and I will be taking you through the first half of the presentation. We then have Glo McLaughlin, who will be taking you through the last part. Candice, Melissa and Ashley are here supporting and will be entering links into the chat function as well as monitoring the chat and questions. Marie McCary, our Chief Nurse, oversees the programme, and as a team we have the knowledge, skills and experience from all 3 sectors, which is adults, children and young people and early learning and childcare. So here we have the session overview. We're going to be looking at the Act again, just to refresh everybody's memory. We're also going to be looking at the resources that are available. We'll have a little bit of chat around the local and integrated authorities reporting duties. We'll discuss inspection and self-evaluation. And as I said, there will be any questions will be answered in the chat, and we will also have an evaluation that you can complete at the end. So we know that there are challenges in the social care sector in Scotland. We understand there's ongoing high fuel costs, increases in inflation, and the general cost of living is putting pressure on employers to meet some of this additional cost in staff wages. Local authorities are facing difficult challenges in setting budgets and making savings in order to continue to be sustainable. The difficult wider economy and financial context impacting on budgets for local authorities and social care. Concerns around UK immigration policy and the impact this is having on recruitment and retention in the sector, an ageing population that may demand more from services, and increased competition for working age people in the labour market. For example, we are all fishing in the same recruitment pool. To help us adapt our presentation in relation to need, it would be helpful if you could now undertake this short survey. It is anonymous, we do not get any details, and it will help us in our reporting to the Scottish Government. So you can do this by using the link that is in the chat, or you can use your mobile phone and use the QR code that is on the screen, whichever suits you the most. Please complete this. I'll give you a minute or so to do that now. Again, I want to reiterate, it is completely anonymous. We do not get any details from this poll of who's completed it. So that means that you can be honest as you would like, and we do not know what has been said. So I'm just going to move on to the next slide now. So last year saw the Safe Staffing programme focus on sharing information on the Healthcare Staffing Act across all services and organisations. We held close to 500 events in a range of ways, from online to in-person events, and we've seen over 7,500 people attend these. We will shortly provide a quick overview of the Act. However, we feel it's important to highlight our end of year report for 23-24, which is now available. We look forward to the implementation of the Act as this year's objectives, as well as this year's objectives for the Safe Staffing programme. On screen, you will see our objectives, which you can see are to ensure governance arrangements and reporting are in place and to assure the work plan is effective and complies with legal and regulatory requirements. Continue to increase stakeholder engagement using media platforms and resources to embed the Healthcare Staffing Act into everyday practice. Review and update existing supporting guidance and agree a range of core assurances that will continue to support stakeholders beyond enactment. And explore how compliance with the Healthcare Staffing Act can be reported, including exploring changes to the Care Inspectorate's RICE functions, reporting and data collection processes. There are 4 parts to the Act. Part 1, which is the guiding principles, and Part 3, staffing and care services, are most relevant to social care. Chapter 3A is for care homes for adults only at this stage. Part 2 is only for the NHS, and Part 4 is where we find general provisions which give powers to the Scottish Ministers around enactment of the legislation and to make amendments as necessary. All care services have a duty to follow Part 1, which is the guiding principles of the Act, and Part 3, which includes Section 7, appropriate staffing, Section 8, staff training and qualifications, and Section 10, subsections 1 and 2, having regard to any guidance issued by the Scottish Ministers. There is also specific duties and a caveat about the development of staffing methods and tools in Chapter 3A of the Act, applicable in the first instance to care homes for adults, then other services as the Scottish Ministers instruct. Part 1 provides the main purposes of the Act and the 8 guiding principles, and Part 1A are the overall principles. And these state that the main purposes of staffing for health and care services are to, the main purposes of staffing for health and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use services, and insofar as it affects either of those matters, the well-being of staff. Part 1B is where we have the 8 guiding principles. So to provide safe and high quality services and to ensure the best care outcomes for service users, we have to look at the guiding principles which state improving standards and outcomes for service users, taking account of the needs, characteristics, circumstances of different people, respecting the rights and dignity of service users, taking account of the views of staff and service users, ensuring the well-being of staff, open with staff and service users about decisions on staffing, allocating staff effectively and efficiently, and promoting a multidisciplinary service as appropriate. We know and appreciate the care sector already work towards these principles, and you will have undertaken self-evaluation to demonstrate and capture evidence to support compliance with the Act. Part 3 of the Act places a duty on care service providers to ensure appropriate staffing and covers the training of staff. This was previously covered by Regulation 15 in the Scottish Statutory Instruments. Regulation 15, as of the 1st of April this year, was repealed, and inspectors are now inspecting against Part 3, Section 7 in terms of appropriate staffing and Part 8 in terms of the training of staff. It is Section 7 and 8 of the Healthcare Staffing Act that are now enforceable. So what is meant by a care service, and specifically, what care services does this apply to? Well, a care service is defined in the Health and Care Staffing Scotland Act 2019 as a service mentioned in 47(1) of the Public Services Reform Scotland Act 2010. On the screen here, you will see a list of the services from the 2010 Public Services Reform Act. This includes early learning and childcare, adult and children and young people's services. Basically, it is all services that are registered with the Care Inspectorate. Which staff does this Act apply to? Well, the new Act defines workers in a care service in Section 11. This includes working for payment or as a volunteer, working under a contract of service or apprenticeship. A contract for services or otherwise than under a contract would be, for example, the employee of the care service, agency and other temporary contract workers, self-employed workers, those on apprenticeship schemes and other earn as you learn schemes who are employed by the care services, and all volunteers. There is a lot of useful information about supporting volunteers on the Volunteer Scotland website. There are tips and templates, and that is a particularly helpful section on the website. We have spoken about the connection between staffing and people's outcomes and the genuinely new principle in law about ensuring the well-being of staff. Improvements in staff well-being will lead to increased productivity, improved performance, a sustained workforce, better attendance, improved satisfaction, and an increase in morale, making staff more likely to turn up and be engaged and work more efficiently, and in relation to that, the enthusiasm spreads. This is more likely to bring about the thing that we are all working in social care to do, and that's to improve outcomes for the people we support, which is one of the main purposes of this Act. Also, the statutory guidance for the Healthcare Staffing Act states, when judging whether a service is safe, safe does not mean no risk. Depending on the service, safe may not even mean low risk. Risks are an inevitable part of all healthcare services. In many services, for example, enablement, a level of risk is required and needs to be managed by both service users and staff to support people to achieve their outcomes. Positive risks, as defined in the Health and Social Care Standards, mean making balanced decisions about risks and benefits, recognising that risks to safety are inevitable and can sometimes result in benefits. Staff deployment has the greatest impact on providing high quality standards that bring about the best outcomes for people. Staff skills are matched to the needs and choices of people using the service, and this could be something as simple as there may be a person you're supporting and a staff member who both love to sing. This could make a positive difference to both parties. Staffing is flexible to suit the needs, for example, hospital appointments or social outings. And as you can see on the slide, this was information that we collected from our webinars last year, and this was examples given to us by the sector themselves. The legislation does not impose specific staffing levels, so when determining what constitutes appropriate staffing levels, Section 7 of the Act tells us that care services should consider suitably qualified and competent individuals in such numbers for the health and well-being of people, the provision of safe, high-quality care, and insofar as it affects either of those matters, the well-being of staff. You're the experts on this. You know that if you're undertaking wellbeing checks and promoting people who are generally independently mobile and continent, it is likely you may need a different staff number and expertise than for people who are more complex and use a wheelchair, or in need of assistance of two people and with transfers and support and personal care. Section 7 has a duty on care service providers to ensure appropriate staffing to enable the provision of safe and high quality care, which meet the needs of service users through having appropriate staffing with the right person, with the right skills available in the right place at the right time. The general duty is to ensure appropriate staffing must be carried out having regard to the guiding principles of the Act. So what is meant by appropriate staffing at all times? Care can often be delivered over what we refer to as a 24/7 basis. So the term at all times should be taken as having its normal everyday meaning in relation to aims and objectives of each care service. The changing needs of people who use services over any time may mean 15 minutes, 1 hour, 24 hours a day, a night, a week, a year. The variation does not affect the requirement to comply with this duty. Care service providers must demonstrate that they have made every effort to adjust staffing accordingly in accordance with the factors listed above. This example helps to demonstrate how a service have made efforts to adjust staffing in accordance with the variable factors and the potential and actual risks around staffing. This can help with decisions about staffing and any impact this may have on people receiving a service. It can also help identify the minimum levels for care staffing and capture professional judgment, as well as providing a record or evidence. This can be used along with handover reporting, staffing allocation, and for the allocation of visits in home care, housing support, and planned templated runs. Section 8 of the Act states that any person who provides a care service must ensure that individuals working in the care service receive appropriate training for the work they are to perform and suitable assistance, including time off work for the purpose of obtaining further qualifications appropriate to their work. I would like to add this part of the Act and its wording has been taken directly from Regulation 15. There has been some confusion that this is a new ask. However, all services will already have been working towards this under Regulation 15 since 2011. So here we have some facts about the workforce. The size of the social service workforce rose slightly in 2023 to 212,780, an increase of 0.6% since 2022. The social service workforce makes up approximately 8.1% of all Scottish employment. This increase was driven by the housing support, care at home and nurse agency subsectors. The whole-time equivalent, the WTE, measure of the workforce is 161,000, which is an increase of 0.5% since 2022. The stability index for the workforce is sitting at 74.4%, and this is due to 3/4 of the workforce remaining in the same post from the previous year. The largest employer type differs in local authority areas. For example, services in the 3 island authorities are provided mainly by the public sector. However, in most areas, the private sector is the largest employer. Housing support, care at home, and care homes for adults and daycare of children together account for almost 79% of the social service workforce. The median age of the workforce is highest in the public sector, which is 46, and lowest in the private sector, which is 39. And staff working in early years services in the private sector have the lowest median age of 28. You will be familiar with the learning resources on TURAS, the Knowledge and Skills Framework for Health and Care Staffing in Scotland. Here we have level 1, which is informed and is suitable for all staff and is 4 short videos providing a foundation level of knowledge of the legislative requirements and workload and workforce planning. Level 2, which is skilled, is aimed at team leaders. A suite of 4 modules providing a more in-depth look at the legislative requirements and a clear, applicable understanding of workload and workforce planning methodology. And by virtue of their role and level of responsibility, team leaders will be able to inform, support, and encourage team members with workload planning activities. Feedback confirmed that these were very clinical and difficult to navigate, and that social care had to navigate through NHS sections before they could access the social care sections. The enhanced level aimed at managers is now available. Work is continuing by HIS to improve the resources with input from the sector. An expert level has not yet been released. Questions were included in the annual return about the Knowledge and Skills Framework for health and care staff. However, this resource has been delayed and is not yet complete. The annual return questions were included to collect baseline information about the usefulness of the learning resource to the social care sector. The Care Inspectorate has no expectation that staff or services have completed this learning resource at this time. It is not mandatory. Providers can, however, evidence other training on the Healthcare Staffing Act with, for example, attendance at our national and regional events, accessing resources on the Safe Staffing Hub, and using the information, for example, that's on the hub, like the posters, to raise awareness. A learning and education resource is to be developed as a collaboration between the Act Implementation Team in Scottish Government, the NHS Education Scotland, HIS and the Care Inspectorate, and the SSSC, which builds on the information shared in webinars in June last year. The SWAY provides an accessible resource that enables users to learn about the guiding principles and different duties within the Act, and it is in a way that it can be navigated and you can look at the different pieces of information and click on the links to go to different areas where you will find more information that will help you in terms of staffing in your service. The Staffing Method Framework is a resource for adult care homes and can be accessed on the Safe Staffing Hub page. I will point out straight away, however, this is not planned to be used in every registered service type at present. There is a caveat in the legislation that Scottish ministers may introduce this in other sectors in the future. However, this, of course, would go through rigorous consultation processes. The Scottish Government asked the Care Inspectorate to design a staffing method framework, firstly for the adult care home sector. This has been created in response to Section 3 of the Act, and this has been designed in consultation with adult care homes, services and stakeholders. It considers key elements around staffing that supplements a dependency tool when determining staffing levels. Please don't panic if you see this being discussed in relation to the legislation. It sets out a framework or process to be followed by a care service provider to determine what appropriate staffing is in any particular care service and setting. The Staffing Method Framework is now available as a web and mobile phone application on the HIS Right Services Right Decision Service platform. The link is in the chat, and this resource is on our Safe Staffing Hub pages. We have created lots of resources to support the care sector, and if you go to our hub pages, you will find posters, you will find FAQ section, you will find an information of series guides, and we also created cards which were given out at our in-person events last year, and we do still have cards left. So if people would like a set of cards for their organisation, then please do get in touch with us at the Safe Staffing email address so that we can send a copy out to you. But we do also have the resource Made into a Sway, which is available on our hub pages, and you can use that at any time if you go onto the hub pages, and the link is in the chat. We're just going to pause to complete 2 short surveys. We hope you're all comfortable and confident assessing the Safe Staffing Hub. So firstly, we are keen to hear which type and format of resource works well for you. This poll is just going into the chat now. It is anonymous, so take some time to let us know what resources work best for you. I'm going to give people time to think about this and answer what they think is most beneficial. Okay, I've given everybody some time there. So secondly, if there is information or a resource that you feel would be useful, please add your suggestions to the next short survey. So thank you very much for taking the time to complete those short surveys. And again, they are anonymous, so please do feel free to answer in any way you wish and put in any resources that you think would be beneficial that we do not currently have. I'm now going to hand you over to Glo, who's going to take you through the next part of the presentation.
Thanks, Steph. And again, welcome everyone. What I want to do in this next section is just try and pull together the impact of this Act across services and just explore some of the places that you may see where it sits well around inspection and around reporting, so that you're getting a real sense of how you're going to blend this into your everyday activity. So firstly, just some of the other resources that are still being developed and going live as we speak. We have just started work with the Health and Care Staffing Act Implementation Group, and we've just agreed the terms of reference with that group, and we're already looking at some of the key themes and maybe some of the sub-work group that we may look at around the implementation of the Act. And certainly some of that's going to include some podcasts where we hope to get providers in the sector, because as Steph says, the answers are going to come from the sector. You're the people delivering the services, and this is where we're going to see how this Act actually takes to life and is embedded into services. We're continuing work with the SSSC and HIS around the development of further resources. We've just shown you those screen grabs of the staffing method framework that now sits on the Right Decisions service platform, and there's a wealth of other resources on that Right Decisions platform, and it's really worth linking in there and looking at the other training resources. And one of the pieces of work that we've been doing certainly in the first quarter of this year during April, May and June is looking at every single report and looking to see where inspectors are making requirements and areas for improvement and where they're actually using the Act to inform that improvement work. And that gives us information to take back to our own directorates and also to share with Scottish Government. Next slide, please. So in summary, Steph's taken you through and just reminded you about the guiding principles, those two main purposes and those 8 principles, and the fact that it's part 3, section 7 and 8 that are the enforceable parts of this Act, and that's around staffing, safe staffing, allocation and training. The other sections is that ongoing guidance from Scottish ministers, and we think this Act will develop and will evolve over time, and we do expect to have further guidance from Scottish ministers. And of course, the staffing method framework, which was written initially, there was talk that it may have been mandatory, but it's currently guidance only. And again, that's there to help care homes, adult care homes, look at the core elements of staffing and safe staffing within a service. And we are encouraging other services to look at this as well. Next slide, please. So one part of the Act will be this ongoing duty to report, and local authorities and health boards have a duty to report. Health boards report and put information in on a quarterly basis, and our local and integrated authorities, or HSCPs, as we often refer to them, will report on an annual basis. So the reporting period started on the 1st of April 24, and that will run through to the 31st of March 25. And it's kind of anticipated that the reports are likely to be with ministers around June 25. And it'll be no surprise that that reporting is asking health and social care partnerships to be assured at the time at which they plan and commission services that care services have regarded the principles, the staffing, the training, they're aware of any statutory guidance, and again, any new guidance that comes out, they'll be able to access that. And that leads on to 2 reporting questions. Next slide, please. So the 2 questions we'll put on the screen, and the HSCPs have to detail the steps that they have taken as organisations across Scotland to comply with the Health and Care Staffing Act. So when they plan and secure services under contract, every local authority and every HSCP must also be aware of the requirement that's been placed on you as care providers in respect of the guiding principles, the duty that's on providers with respect to staffing, the requirement around training, and those requirements around ongoing guidance. Next slide, please. Question 2 will then ask HSCPs to be aware and capture any ongoing risks that may affect their ability to comply with the duty set out in 3.2 around reporting. They've got to detail any risks they have encountered around planning and securing services that would affect the HSCP's ability to be sure that you as providers are able to adhere to the compliance of the Act. So there may have been difficulty around accessing particular services. It may be due to a lack of staffing or particular training that's needed, and they may not be able to access the information they need to assure themselves of your ability to comply. And again, there may have been potential risk, there may be shortage of services in areas, there may be limited choice when they want to plan and secure services. And the range of different care service and types of contracts or arrangements may have made it difficult to incorporate the requirements into the Act, and that may be due to the urgency of the particular care that they're needing. And certainly in care at home and housing support services, we can see some purchasing outside of contractual arrangements, some spot contracting, and around care at home, it may be that your aims and objectives and the conditions on your registration may be causing some restrictions if you're wanting to expand the range of people that you're giving support to. And these are things that will be good to be captured in reports and fed back to Scottish Government. Next slide, please. So it's important to know that this annual reporting really, when they're looking at planning new services, so it's that one-off in any financial year, these questions will be completed around new services that are planned and secured. And there's no requirement to report, for example, on services that are already sitting in contract. And again, in care at home and housing support, there could be contracts that have been in place for 2 or 3 years. There may be particular contracts around step up, step down care, and it's only if they're renewed or negotiated. So it is new contracts that will be reported on an ongoing annual basis. Next slide, please. So how are they going to get this information? We don't want to put additional pressure on services around reporting, and the Act's not prescriptive on how this information would be gathered. It may be that the health and social care partnerships will already have access to some of this data through some of their own quality assurance and monitoring processes, and if not, they will need to consider how they're going to obtain that. But they could look at inspection reports, joint inspection reports, and certainly this year we're looking at staffing as a quality indicator and as a new core assurance. And the Care Inspectorate also has a data store, and health and social care partnerships will have previous experience around commissioning and will have some information, but they can also access the data store for the Care Inspectorate, and they will know what fits in best in their own local authority. Next slide, please. So the inspection priorities for the 24-25 inspection year for adult services. For poor performance services, we will look at quality indicator 1.3 under key question 1 and 3.3 under key question 3. And of course, the inspector can identify one or more quality indicators based on intelligence and any other factors that they want to look at when planning that inspection. And for better performance services, the planning footprint would be to look at 1.3 and 3.3. But of course that can increase in any inspection. An inspector can pause, review the information they've got to date and come back and discuss with the manager what plans they have to introduce any other priorities. Next slide, please. So this is the quality indicator framework, and again you can see that 1.3 under key question 1 talks about people's health and well-being, and it benefits from their care and support. So a close link to those two main purposes of the Act around high quality services and good outcomes for people, and 3.3 talks about staff and arrangements are right and staff work well together. So again, around those guiding principles around staff allocation and training, they align very nicely with the Act, and it gives us a good basis on which to look at those inspections to be able to report back over this inspection year. Next slide, please. We assess the core assurances that you can see on this slide in front of you, and we do this at every inspection except a follow-up, because we will already have looked at them at the initial inspection. So in an inspection, if we have any concerns arising from the assessment of a particular core assurance, we would have to consider evaluating the relevant additional quality indicators that would align to that particular core assurance. But of course, we will use a proportionate approach in carrying out the core assurance activities as part of an inspection, and this is where we sample and we make a decision about whether or not we need any further scrutiny activity in that area. And you can see at the bottom of the slide, the new staffing core assurance has been added, and it simply says the numbers, skill mix and deployment of staff are determined by an effective process of continuous assessment featuring a range of measures and is linked to quality assurance. Now that will go into the quality frameworks as they're updated, but that's available now to inspectors in their inspection guidance when they look at the core assurances as part of inspection. Next slide, please. So, we first began discussing self-evaluation and test inspections with providers at the start of February 24 this year. And since then, our methodology colleagues have regularly shared information with the sector through provider updates and social media posts about testing self-evaluation of the core assurance. This has been done to support services in preparing for self-evaluation of the service, and to ensure that testing of self-evaluation with core assurances were not a surprise. The Care Inspectorate and colleagues in methodology have been working with adult care services to further develop skills around self-evaluation and support our upcoming test, where inspectors were validating the service's self-evaluation during inspections. This has included holding webinars, which were attended by over 800 people working in or providing adult care services. At these events, methodology provided practical support and help to services to understand the process, as well as providing information on the test inspections. And feedback from those webinars was very positive. We heard that the information was clear, easy to understand, and people enjoyed the real life examples of how self-evaluation had actually improved services. Next slide, please. Self-evaluation is where a service systematically and regularly examines itself, its achievements and its processes in order to assess whether it's meeting its own stated objectives and outcomes efficiently and effectively. You don't need to have a separate improvement plan relating to self-evaluation in the core assurances if you've got one already, but we know that core assurances are a key driver to improvement in outcomes and to minimise the risk of poor outcomes for people. And this is why we examine them at every inspection. So as core assurances are already a part of every inspection, you will be familiar with them and you know that we look for evidence relating to them. The core assurances are the fundamental basics of a service, so services should know their strengths and their areas for improvement in relation to the core assurance. It makes them a good starting point for all providers to think about self-evaluation, and we want staff to be confident when undertaking self-evaluation. So all adult services with an inspection that was scheduled between July and September, the end of September of this year, was or will be involved in the test regardless of their current evaluation grades, etc. The aim of these tests on the core assurance and self-evaluation is to simply get information about what stage services are at with self-evaluation, how well adult services are self-evaluating, and how easy is it to effectively validate services evidence around self-evaluation. So self-evaluation is something that services should be doing not solely for the benefit of the Care Inspectorate. It's a tool to help identify and evaluate where you need to target efforts to improve outcomes for the people that you care for. So we want services to feel empowered to be able to do it well and to recognise the benefits. Feedback from inspections will help the Care Inspectorate identify future steps to support services to adopt self-evaluation. But we understand the pressures the sector has been experiencing, so we're adopting a very phased approach, which is why we're looking at core assurances in the first instance. And of course, many of you may be already self-evaluating your entire service, and you must continue to do that. The list of core assurances that we saw at the earlier slide can be found at the front of every quality framework, so you will find them in the framework for care homes. There is more information and guidance around self-evaluation in our toolkits. There are suggested questions to ask different groups and people that you care for and work with, and worked up examples of self-evaluation. And the toolkit also has templates, but of course you don't need to use our template. If you have one of your own, you continue to use that. And Candice and Melissa will be popping those links into the chat. Next slide, please. The testing is now well underway, and it will help the Inspectorate to establish that important baseline and understand the next steps we need to take to be able to support services to adopt this approach. And of course, it will help building that confidence and relationships between inspectors and the services on their caseload to be able to support that self-evaluation and that proportionate inspection activity as well. So we would encourage all services to complete the core assurance self-evaluation and have a service improvement plan in place. And of course, we know that you will involve the people who use your service, families, friends and carers who use your service, staff at all levels and roles, external and other stakeholders. And providers can do this in whichever way works for them to include people in the process. Next slide. So these are the links that will be going into the chat now, just that you're able to pick those up. And of course, they are also on the hub. Next slide. And we just wanted to take a moment and just remind you of this important guidance. This is guidance that's been around for a long time, and it's certainly been updated and refreshed. And this is really a central document with regards to services records and helping you provide that evidence and having that analytical approach to your processes and your systems. So for care homes, it'll ask you for a wide range of information. It gives you information about staffing, about those qualitative and quantitative records, that 4 weeks of rostering that we'll ask you for when we come in on inspection to look at what happened 2 weeks ago, what's planned for the next 2 weeks, or in whatever format you provide it. And of course, it gives you that cause and effect information that if you've got those records and you're looking at them through your quality assurance processes, they'll help inform that evaluation. So a really central key document not to lose sight of. Next slide. And this final wee bit about other activity that's happening, as you may have heard about the Care Home Improvement Programme, shortened to CHIP, and Cohort 1 have just produced a flash report. Next slide, please. So between April and August of this year, the Care Inspectorate successfully completed the first cohort of the CHIP programme, and this programme supported care home staff in implementing quality improvement initiatives to enhance the quality of care for residents. And you can see that it was aimed, the criteria for entry was services with an evaluation of adequate. And you can see there was 37 care homes participated in the applied to take part, 30 were shortlisted and 28 completed the entire programme. And that number in itself is a really good outcome. And there was a recent celebration for Cohort 1 and just a lot of really positive information shared around the outcomes for people. Next slide. And we know there's going to be some more cohorts, so it's worth making sure that you're keeping an eye on the hub and that you're looking at the provider updates. As you can see, the results around agree and strongly agree that the programme really improved people's learning, increased their knowledge, and increased their confidence about new approaches within their service. A really outstanding outcome, and it's really worthwhile keeping a wee eye out for those programmes. And I'm going to hand you back to Steph now, who's going to just take us through the final evaluation and close the event. Thank you.
Thank you, Glo. That was really helpful. As you can see, you can contact us here at the Safe Staffing Project at careinspectorate.gov.scot. We also have our hub pages where you can join our mailing lists, where we send out information, and when we get it through, we make sure we're sending it out on our mailing list and keeping people up to date. We do have a short evaluation. It is completely anonymous, and we do use it to look at what we are providing to the sector. So if you do think that we need to provide other things, or we could improve on some things, we would love to hear from you, and that is where you can do it. So the self-evaluation link will be in the chat, as well as you can use the QR code here on the screen as well.